How to select your psychiatrist. That's the question we're going to answer. We'll start with 3 key points. We'll then talk about how the 3 key points are so important, and then talk about Stephen's experience in selecting his psychiatrist.
Welcome to Surviving Schizophrenia with Stephen. I'm Stephen. I live with schizophrenia and produce videos on mental health. How do you select your psychiatrist?
Well, the 3 key points that we want to talk about would be, the first one would be select an experienced psychiatrist. And you can get a referral. Oftentimes referrals are a good way to get an entrance to a psychiatrist. And the selection process that I would use is look at their educational experience, where did they go to school, and look at their clinical experience. Is this a psychiatrist that is seeing a lot of people and a wide range of people? Because I would want, and as part of the first point in selecting an experienced psychiatrist, I would want a psychiatrist that is a clinician, that went to a good school, did well in school, preferably, and is a clinician, meaning he or she sees a lot of people and has a lot of experience in dealing with people with schizophrenia, major depressive disorder, anxiety disorders, depression, bipolar disorder, and just a broad range, autism even, and a broad range of mental health illnesses. So the first key point in how to select your psychiatrist would be to select an experienced psychiatrist. What about the second point, Stephen?
Yeah, you want to choose a psychiatrist that listens to you.
So why is that so important as the second point?
Yeah, if your doctor's not listening to what you're saying, of any kind of doctor, you're not going to get the help you actually need. Right.
I think that's a great point, Stephen. There's got to be a dialogue there between the patient and the doctor, especially with mental illness. Because if the doctor or the psychiatrist isn't listening to the patient, then that doctor's not going to get a full picture of what that person is going through. And so choose a psychiatrist who listens to you and with whom you can have a conversation, I think is the second key point. What about that third key point, Stephen?
Yeah, don't shop for the opinion you desire.
So I think that here you want to trust your psychiatrist. Don't shop the opinion. And it's an important point because these are expert doctors. Anytime you get an expert, especially in the mental health field like a psychiatrist, you might get a number of different opinions from an equal number of different psychiatrists. And that's because it's such a complex illness and such a tough disease, schizophrenia. And these are not well understood illnesses, the mental illnesses. And there are a lot of different antipsychotic medications, antidepressants, and other medications that the doctor can use to help alleviate the symptoms of the illness. So because there's such a wide range of mental illnesses and a wide range of medicines that are used, you can get an equal number of opinions as doctors that you see. And you can also get an equal number of opinions as to what illness you may be suffering from.
That's true.
So I would not shop the opinion. I would trust the psychiatrist. So don't shop the opinion you desire would be the third key point.
Sure.
And again, those 3 points are so important because the psychiatrists in treating schizophrenia are treating the symptoms of the illness. They are not treating the underlying cause of the illness. And the treatments that are available for schizophrenia do not cure, and again, treat the underlying causes of the illness. And that is so important for us as parents and for those suffering from schizophrenia to understand that the psychiatrist is treating the symptoms. And so that is particularly why how to select your psychiatrist is so important. So I'd go back over the three points, Stephen. What would be the 3 key points then in selecting your psychiatrist?
Yeah. Number 1, select an experienced psychiatrist. 2, choose a psychiatrist who listens to you. And lastly, 3, don't shop for the opinion you desire.
Right. So Stephen, what has been your experience? Now, you fell ill in March of 2012. It's been almost 11 years, coming up on 11 years that you've been seeing a psychiatrist. You've seen a number of different psychiatrists. Early on, you were hospitalized at UCLA, Neuropsychiatric Hospital. Saw a couple psychiatrists there, and then you were in the CAPS, CAPPS UCLA program for about 4 years in a research project there in 2012, 13, 14, and 15, and actually into 2016. Saw a number of different psychiatrists there. But also at the same time, you had your really what I call your home psychiatrist. Yeah. So how would you, in talking about what has been your experience then with your psychiatrist?
Well, I feel comfortable talking to her. That's very important. You have to be comfortable, and you have to feel comfortable talking to your psychiatrist, or really any kind of doctor for that matter. I feel really like I can tell her anything, and she'll only do the very best to help me with whatever I have. But I tell her that are issues around my schizophrenia.
That's awesome, Stephen, and that's why Stephen has had his what we call his home psychiatrist here for almost 11 years now, 10 and a half years. She's been phenomenal,
She really
and
has.
what Stephen said, that he can talk to her, discuss his feelings with her openly.
Yes.
That is so important. Does she take interest in your life, Stephen?
She does. When I do have visits with her, it's not just talking about my schizophrenia or just talking about my stressors or anything like that. It's definitely part of it. But I also can just talk about stuff that's going on in my life. Like, I don't know, maybe I saw my family member recently. I'd talk about that. Early on, we were reading similar books, and so we talk about those books and stuff. So it's not even just all medical stuff I can talk to her about. And she listens, and yeah, she listens.
Right. So, and Stephen also has his therapist. So the psychiatrist is not going to take, replace the therapist.
No.
So you're going to need, with schizophrenia, an experienced and psychiatrist that you trust. You're also
Sure.
going to need a therapist. The, Stephen's psychiatrist is primarily medication management,
Yes.
and leaves the therapy to Stephen's therapist. So, what about in discussing medication with you, Stephen? How does she go about explaining the medication to you and any side effects?
Yeah, she just says it openly, really. She says, this medication might help with these symptoms, but at the same time, you could have all these side effects. And she doesn't try to force anything upon me. She values my opinion and lets me think about what I think would be best as well, while giving her input as saying what she thinks would be best for me.
Right. So, and that's awesome, Stephen. And in selecting, how to select your psychiatrist, I think if you focus on those 3 key points of selecting an experienced psychiatrist, choosing a psychiatrist that you can talk to, you have a discussion, that will listen to you,
For sure.
and then don't shop around for the opinion. Stay with that psychiatrist. Trust your psychiatrist. I think that also helps very much in the long term with a chronic, especially with a chronic illness like schizophrenia, because the key here is not to jump around on the medication, not to switch around. Because otherwise you'll lose track. I think if you switch your medications too quickly or too often, you lose track of kind of where you're at and where you've been.
That's very true.
What's worked and what hasn't. And I think one reason why we've been so successful with Stephen, with only that one hospitalization in 2012, given his severe schizophrenia, is that we've trusted the psychiatrist,
Yeah.
and that we've not jumped around in medication, and we've been very careful, and the psychiatrist has, in determining what medication Stephen should be on, and then making just small changes over time,
Yes.
instead of making any type of rapid changes. So,
Because sometimes it takes a while to know if the medication is actually going to work for you. And if you change medicines too fast, you might not know.
right, and then if the psychiatrist isn't, fully listening to the patient, the psychiatrist isn't going to get that information from the patient. So, that's great. That's great, Stephen.
So that's how we would answer the question, how to select your psychiatrist. And we'd love to hear from you. If you have any comments about anything we talked about in this video, definitely leave them down below. We'd love to hear from you.
Absolutely.
So we hope you have a happy and healthy rest of your day. We hope to see you in the next video.
Hope to see you in the next video.
Bye.
Take care. Bye-bye.